Hello, this is Dr. Michael Lau. In this episode of the Understanding Beauty Tech series, I'm going to explain to you about the regenerative facelift, which is doing facelift non-surgically using advanced regenerative technology. To understand why we need facelift, let's look at what happened to the face and head as we age. So as we age, the skull and the facial bony structure will start shrinking. In doing so, it generates a sort of size mismatch. So basically, imagine you're wearing a size 8 dress on a size 2 frame. That won't work too well, would it? So the excessive, redundant, so to speak, skin, fat, support tissue over the shrinking skull will end up sagging by gravity, generating lines and contour changes, sagging, and causing all sorts of aesthetic concerns. So traditionally, we do surgical facelifts. So how do we do it? Basically, we make an incision around the ear, in front of it and behind it, and then excise the excessive skin to tighten the skin and sort of pull it back. Some techniques will involve tightening this and suspending the subcutaneous tissue and fixate it so that they help to retain the contour, but always involve pulling back and tightening the skin. So how do we use regenerative aesthetics to help in to give an option of non-surgical facelift? So regenerative means regrow, regenerate, rejuvenate. It's just more than anti-aging, which is just keeping things steady. We actually improve, regenerate, renew. So regenerative aesthetic helps to improve the fundamental cellular renewal process, and the effect will last much longer because it's a fundamental change. It's at the cutting edge of forefront of aesthetics with ongoing scientific and technology innovations. We're really excited about this technology. To give some background to you about my qualification, why I can act as your guide to explore regenerative technology. I started as a scientist. I was a PhD student at the University of Washington in both nuclear physics and chemistry. I continue to use my scientific training in the practice of surgery. I'm one of the first surgeons that used laser in the Pacific Northwest in surgery. And also I developed biotech and beauty tech devices. For example, this new device is, I'm a co-founder of the company. We use ultrasound to help drive and deliver more of the skincare product into the skin. So besides being a cosmetic surgeon and aesthetic medicine specialist, with training in both cosmetic surgery and gynecology, I'm also a cosmetic chemist, and I'm very active in developing beauty devices, advanced degree in chemistry and physics and management, MBA in technology. I'm still a research scientist, quite active, studying perception, attraction, devices, biotech. I'm a clinical faculty at the University of Washington School of Medicine and a visiting scholar at the University of California, Irvine School of Engineering, both in electrical engineering, computer science, and biomedical engineering. I've co-authored several peer-reviewed journal papers and U.S. patents. So what kind of technology do you bring to give an option alternative to the surgical facelift? So the regenerative facelift uses advanced technology involving strategically skin tightening and rejuvenation, also contour improvement. So we use regenerative microneedling technology to help deliver growth and healing factors from exosomes, stem cells, and PRP through microneedling. And also we use energy technology, radio frequency, mechanically assisted, and use the infrared to help tighten the skin, but also help to deliver regenerative energy changes to help the tissue to regenerate. And we strategically place dermal filler to even improve the foundation bone structure, to improve the contour of the face as well. So in use regenerative facelift, we use microneedling coupled with regenerative agents to tighten the skin through the face and neck. In addition, we use energy device, in our case, Shape 3 with mechanical assistance infrared to improve the skin laxity, reduce fat deposit, and to improve the contour of the neck and the jowl line. And then we place strategically dermal fillers to lift the arch, for example, to improve the contour, to bring you back to a more youthful look, similar to what surgical facelift could achieve. So how does microneedling work? Just microneedling by itself, we're creating micropunctures about 0.5 to 3 millimeter deep. They're not very deep, but it will be enough to create micro injury even to a deeper part of the skin layer. The injury will generate cascades of wound healing factors, such as growth factors, platelet, related growth factors, connective tissue activating protein to generate collagens, elastin, and tighten the skin and rejuvenate the skin. And then the microneedling can be used to help the penetration of the treatment agents such as PRP and exosome that we can talk about. So microneedling by itself can improve the skin elasticity, tighten the skin, smooth out fine lines and wrinkles, help to reduce large pores, reduce sun damage and dark spots, help with acne scar and stretch marks. But you can also use adjunct therapy to adding microneedling some of the regenerative agents to enhance the effectiveness of microneedling. So using some of the adjunctive treatments with microneedling can enhance the effectively in treating, try to improve hair loss, skin rejuvenation, skin tightening. Some of the agents that we use are PRP, which we explain more, platelet-rich plasma, stem cell and the derivatives, and exosome and the derivatives. So what exactly is PRP? PRP stands for platelet-rich plasma that we use with microneedling. So platelet is a cell component of the blood, help with coagulation, and we can concentrate the platelet component in the plasma, which is the fluid portion of the blood, by spinning down blood. Just a few tablespoons of your blood will be needed, and then we systematically spin it down, centrifuging it to concentrate the platelet segment of the plasma, which is full of growth and healing hormones. Those bioactive factors can be used to enhance the effectiveness of microneedling and laser treatment in cosmetic surgery. I've been using PRP, initially started 25 years ago, in making sure using fat transfer to the breast will work beautifully with the help of PRP. It's completely safe. PRP from your own blood, your own plasma, your own platelets. So I'm sure you heard of the term vampire facial or vampire facelift before, popularized by a lot of celebrities. But actually what it is PRP enhanced microneedling facial. The vampire part, because blood is being used. Well, the PRP from your blood contain a lot of very strong growth factors and healing factors delivered through microneedling to deeper layers. You can see the improvement promptly and have low or no downtime. You see the example of this one patient. You can see immediately the very nice, after a little while, the nice change in skin texture, tightening, and the appearance of the skin. The FDA approved the use of PRP microneedling if it's done as a medical procedure under the direction of a physician, and again, it's very safe. Your own blood, your own platelet, your own serum. So in the recent few years, the term stem cell and its derivatives has been used in medicine and aesthetics. So what are stem cells? Sometimes stem cells are the multipotent cells. That means that cells that can develop into all types of different cell types, make up our body, bone, skin, hair, body parts, etc. And it has the potential to replace and repair cells that are missing or dysfunctional. Now, embryonic stem cell, an embryo can develop a whole body as well, that. But stem cell can be harvested from adipose tissue, fat cells, bone marrow, umbilical cord, embryonic cells that can be grown in cell culture and extracted stem cell and is the derivative for use. Now, FDA still views stem cell treatment experimental. Is that investigative studies are being done to see its efficacy in skin rejuvenation, and we are using it as a supplement to the approved PRP microneedling. We will talk more about that. So just very recently, exosomes are being used in aesthetics. They've been used in medicine for a while, but still investigational. What are exosomes? They're what we call extracellular vesicles. They're small nanoparticle, and the derivatives. They basically are small nanoparticles generated by the cells, bilayer lipid layer. They contain nucleic acid, protein, lipids, metabolites, growth factors, healing factors. Is a mediator between cell communications to activate tissue repair and growth. It's a very potent messenger. Most commercially available exosomes are actually they're called allogenic. That means not from your own body. So they could be from plants or, mesenchymal stem cell, for example. FDA still view exosome treatment as experimental because there's not a standard, classification and effectiveness of those exosomes. So it's continuing to be viewed as investigational. We're investigating the efficacy of such in conjunction with the standard treatment of PRP microneedling. To summarize, the regenerative agent as tool to help us in aesthetics, microneedling, and skin rejuvenation, we know that the PRP is acceptable to FDA for hair loss, hair growth, and skin applications, as long as done under the supervision of a physician as a medical procedure. As I said, using it for skin rejuvenation, hair loss. Stem cell exosomes, EV, extracellular vesicles, and the derivatives for hair and skin treatment are all still considered experimental by FDA. To support its efficacy, investigations are done. They're all mostly allogenic from a different source than your own body, different ingredients and characteristics. So we really need some professional guidance as you consider using those new regenerative agents beside PRP. To further improve the effectiveness of what we call regenerative facelift, besides using microneedling with regenerative agents, we use the RF energy to help as well. We use a Valus Shape 3 system, What it does is safely and non-invasively help to achieve tone, contour, and well-shaped body. There's no downtime, no much discomfort, have dramatic results. So how does VelaShape work? Basically, it's a system using radio frequency, electric energy combined with infrared and vacuum to help to create deep heating to reduce the fat cells, tighten the connective tissue, and improve regeneration of the dermal collagen fibers and elastins to stimulate the growth of the new collagen and elastins, which reduce the skin laxity and over improvement the skin structure and tightness and the texture and appearance. But more importantly, it can help in tightening the skin and reduce the fat deposit to improve the contour of the neck as well. So there's some example from our own patients, permission given to use those pictures. So what the VelaShape can do, the upper photos show a patient with VelaShape to the neck. You can see the reduction of the contour, tighten the skin, and create a much more beautiful jowl line. And then the lower photographs show dramatic change of the abdomen in terms of reducing the contour, the fat deposits, and actually got rid of some of the stretch marks, and big whole area looks a lot more attractive. So in combining the innovative regenerative microneedling with energy technology, radio frequency, and strategically placed dermal fillers to help in improving the contour like the arch of the bone, we can do regenerative facelift, similar to what can be done in surgical facelift. The advantages: it's not surgical, it's comfortable, fast recovery, no downtime, it's cost effective, it gives fundamental tissue improvement for long-term effect in skin rejuvenation besides just tightening, and also contour improvement as well. Well, I hope you enjoyed watching this video. Please subscribe to my video library and follow the Understanding Beauty Tech series, which is updated weekly. Thank you and take care.